Hello guys, this is Dr. Zina speaking. I hope you are all doing great. Today's video is about what is van der Wood syndrome. But before we continue, make sure to hit the subscribe button down below for more and more videos. So let's start now. Van der Wood syndrome is a condition that affects the development of the face. As you saw from the previous picture, that the development of the face is affected, in which the patient will be having as the following symptoms. So the symptoms are as the following, starting with the patient might be having cleft lip alone, or cleft palate alone, or a combination of cleft lip and palate can be seen in those patients. But we want this condition we want to differentiate it from other conditions who are having only cleft lip or palate or a combination of both. In that saying, what do I mean? Those patients, they will be having, in addition to the clefts, is anodontia. Anodontia can be either complete or partial anodontia. But which one is more commonly seen in those patients is the partial anodontia, which means that they will be having teeth, but only like less than 6 teeth are missing. So partial anodontia. And you remember in my previous videos, I talked about the anodontia, the hypodontia, and oligodontia, all these. Anyways, for those patients, they will be having either complete anodontia, which is no teeth at all, or partial anodontia, like patients with ectodermal dysplasia. Patients with ectodermal dysplasia, they will be having partial endodontia, which means that less than 6 teeth are missing. But also, we can also see in patients with ectodermal dysplasia, the partial endodontia, which is the oligodontia, another one, which is the oligodontia, in which more than 6 teeth are missing. So either can be hypodontia or oligodontia for ectodermal dysplasia patients. Anyways, my topic is not about ectodermal dysplasia, and if you want to understand furthermore about the ectodermal dysplasia, you can see my previous videos. Now, in addition to these 3 symptoms, they will be having a characteristic feature, which is the pits in the lower lip. Always, you will be seeing a pits in the lower lip. Pits in the lower lip can be seen in those patients. Why is that? Because there is an abnormality that can be seen in the face, commonly in the lip area. Commonly in the lip area, basically, you will see many abnormalities. One of these is the cleft lip, cleft palate, pits in the lower lip. So all these basically uh, what you will be seeing in those patients. So always, for those patients, you will be looking first in the lips. Whenever you see the lips, they will be having either cleft lip or cleft palate. In addition to that, the pits in the lower lip, make sure to know that you will reach your definitive diagnosis, which is the van der Wood syndrome the patient is having. Now, how can you remember one of the symptoms, at least like one of the symptoms of the van der Wood syndrome, which is the most important one in order to reach the definitive diagnosis? Because as I said, that whenever you see pits in the lower lip, immediately you will know that this patient is having this condition, right? Now, so how can you remember this last symptom? Remember the actor, the famous actor, as I think you might all know, which is Brad Pitt. So remember from his name, Brad Pitt. So pit is the pits that are seen in the lower lip. So whenever if you forget this condition, the symptoms of this condition, remember Brad Pitt. Remember the name Brad Pitt. So pits. So pits that are seen in the lower lip. In order to know that this patient, if he is having pits in the lower lip, which means that he is having such a condition, if he is not having pits in the lower lip, which means that this is another diagnosis for the patient, another provisional diagnosis will be done for the patient, not this condition. Now, what are the causes behind such a condition? There is an abnormal mutation in the genes that affected the development of the face, resulted in such a condition. So there is an abnormality. In addition to that, if one of the parents, they have cleft lip, there is a 50% chance the child will be born with cleft lip as well. So it is also hereditary. If one of the parents, they have abnormality in one of their genes, it will be carried on to the next generation, which is their children. They will be having the same condition as well. Now, what is the treatment that we can provide for such patients? Normally, for any patient with a cleft lip, we will do a surgical repair when the child is 3 months of age. If the patient is having cleft palate, we can do repair when the child is 10 months of age, so that we can make sure the palate is completely developed, the lips are completely developed, and we need to do basically immediate repair for those cleft lip and palate, because the patient, he cannot eat. Whenever he eat, basically the food is going into his nose because there is a cleft in there. So we need to do an immediate repair for such clefts for the patient. For the anodontia, of course, when he has, like any patient, any old patient, when they lose their teeth, what we will provide for them? We will provide for them a denture. Similarly to those patients in here, they are having anodontia. As I said, it can be either partial or complete. Anyways, in either cases, we will provide a denture for the patient. So just provide a denture for the patient in order to solve the problem for anodontia, or to solve the problem for any old patient who is not having teeth, we can give a denture. So simple as that. So thank you all for watching my video. If you have any questions or if you are in doubt of anything, please do write it down in the comment section below, and I will be more than happy to answer your questions. Thank you and goodbye.